AM560theanswer.com. Now, from the Signature Bank Studios, this is Chicago's Morning Answer with Dan Proft on AM560. The Answer.
Top of the morning, Dan Proft here, and we discussed this quite a bit last week after RFK Jr.'s testimony before the Senate Finance Committee and the spirited exchanges he had with several senators, Republicans and Democrats. And that was against the backdrop of the announcement out of Florida by Dr. Joseph Ladapo, the Surgeon General there, formerly UCLA Medical School. We've had him on the show many times. During COVID, before he took the post as Surgeon General down in Florida. But we've had him on since then, too. But he announced that Florida was making child vaccinations optional across the board, not just for COVID. And that generated a lot of reaction from the medical establishment, as you might suspect. Although, as I mentioned in our discussion with RFK's testimony, you know, I bit of a wait and see approach because I had concerns about RFK Jr. in terms of whether he would be somebody that was practical as HHS secretary and work in a collaborative way with medical doctors who I do have great regard for, like Marty Makary and Jay Bhattacharya. Or would he be more ideological and sort of take some of the postures and approaches he took as an activist now that he's in an executive cabinet level position? And it seemed to me, at least from his testimony, that it is the more pragmatic, collaborative approach that he has taken. Although you can quibble with some personnel choices, I suppose, the question is he pushing sort of a rigid sort of doctrinaire anti-vax ideology. And that wasn't his testimony. For more on all of this, pleased to be joined by Dr. Scott Rivkees, who's a professor of practice at the Brown School of Public Health. He is a pediatrician and former state surgeon general and secretary of health, state of Florida. He has written a piece over at thehill.com that takes a much more critical view of RFK Jr. than I do, which is okay. That's why we're going to discuss it. America, you're now on your own to make medical decisions is the title of the piece. Dr. Rivkees, thanks for joining us. Appreciate it.
Yeah, thank you so much for having me.
So, you know, I read your piece, of course, but I give me your perspective on what RFK offered in his testimony last week, and whether you think that it represents an open-mindedness on vaccines that maybe he didn't always express as an activist before he was HHS secretary.
You know, this is a very important issue, and I think one of the things that those of us in the medical community are very concerned about is that vaccines and vaccination are currently being undermined by Secretary Kennedy. Some of his statements about vaccines, some of the stances that he has taken, clearly have an anti-vaccine bent to them, and is leading to public confusion about it. I mean, the public is not sure where to get information from. You know, the CDC used to be the authoritative source for medical information, but with some of the changes that have happened, particularly with the Advisory Committee for Immunization Practices, the individuals who are on there now, it has led to really a loss of confidence in this process by the medical community and by a good part of the public.
Well, I mean, but, you know, most people trust their kid's pediatrician. They're not trusting the CDC director. They don't even know who the CDC director is. So why can't those decisions be made at the personal level between parent and pediatrician for their kid? Why does there have to be sort of uniformity of opinion among all pediatricians with respect to all their patients?
Yeah, really important opinion. So first of all, the decisions are between parents and their physicians, but in addition, public health puts some other guardrails in place. And what they're talking about is really school vaccination requirements.
Right.
And so independent of what parents decide with their pediatrician, all states in this country have vaccine requirements for children to go to school. And the reason for this is twofold. So first of all, we know that within schools, because children are very active, diseases can spread really quite readily, and you have to have a certain level of protection. So this vaccine protection is really dependent upon two things. First, a parent vaccinating their child, and then also other parents vaccinating their children. So a parent's decisions, whether to vaccinate their child or not, will influence the health of other children. So this is why, going back a century, and the Supreme Court has ruled on this, that vaccines are first neither arbitrary nor are they oppressive. And for the greater good, mandatory vaccination can be required for individuals to go into school. So that's what this discussion is really about.
And just give us the profile on some of these vaccines. I unlike many who are armchair epidemiologists and virologists, I try to recognize the limitations of my knowledge in some areas. There's a whole schedule of vaccines that are mandated, and the mandates vary a little bit from state to state. But some of the core vaccines where you would argue that the evidence is overwhelming, that it is a preventative with low risk to the child, such that the vaccination greatly outweighs any potential harm.
Yeah, so let's talk about, one of the ones that's the most controversial vaccine is measles, mumps, rubella, because of the false notion that it's associated with autism. So before measles vaccine came into effect in the early 1960s, there were 500,000 cases of measles a year and more than 500 deaths. In terms of polio vaccine, there are more than 40,000 cases of polio a year. The chickenpox vaccine, which is potentially that requirement could be eliminated in Florida with a new rule change, there are more than 4 million cases a year of chickenpox in the United States. And Dan, when I was a medical intern back at Mass General of Boston, the first patient I saw was a 4-year-old boy who had encephalitis, brain inflammation due to chickenpox, and this child was left neurologically damaged. That would not happen now. So, there are vaccines that have been around since the 60s, newer vaccines which have been added, which are incredibly protective. Also when I was an intern, we used to always take care of infants and older children who had Haemophilus influenza, meningitis, again left with either hearing loss, neurologic injury. These diseases really are a thing of the past. These vaccines, after they're released, they continue to be monitored. They have an excellent safety profile. Of course, there are side effects, but these side effects are very, very rare. And we have to balance these very rare side effects against the consequences of these diseases that can spread among children really quite readily.
So in those vaccines, you're describing the benefits far outweighing the costs. What would you say about COVID vax for kids?
Yeah, so first of all, in terms of the pandemic, just to put things in perspective, more than 2,000 children died from COVID during the pandemic. These vaccines related to children have really been shown to be effective in terms of preventing severe disease. And in fact, the severe disease for COVID now for young kids, it's really in the young kids less than 2 years of age, where we really see incredible morbidity, very high hospitalization rate from COVID. So, there was this issue early on about myocarditis being associated, and this was a rare rare side effect related to the second dose of vaccines. But that hasn't been seen in the past 3 years with the current vaccine formulation and vaccine schedule. So, those of us in pediatrics, who care for children with COVID, we've seen children hospitalized. And the other thing that has come out is that after you have COVID, even it can be a mild case, you sometimes can have a condition called long COVID. And again, this is prevented by vaccines. So again, 2,000 children have died from COVID. Most of these children are actually healthy children without underlying medical conditions, and these were potentially vaccine preventable deaths.
Well, on COVID, I mean, this is a piece from Dr. Marty Makary from 2 years ago, where he cites a number of studies. He writes this: if public health officials got their way, every healthy 12-year-old girl in America would get 70 COVID vaccine doses in her average lifespan, with a risk of heart damage, myocarditis, you just mentioned, after each shot. Instead of following the science, U.S. officials continue to propagate old myths that vaccines prevent transmission and that myocarditis is more common after COVID than after the vaccine, and that's not true. Myocarditis is 4 to 28 times more common after the vaccine in a cohort of young males, a recent JAMA, Journal of the AMA, cardiology study found. University of Basel study, asymptomatic heart damage occurred in 2.8% of people after the COVID booster, as measured by the troponin test. He goes on to cite other studies that suggest that the benefits do not outweigh the costs with respect to young people and, an endless series of COVID boosters.
Thank you for that. I'm familiar with those studies. As I mentioned, this was something that was seen early on, has not been seen in the past 2 to 3 years with the way the vaccines are formulated and the vaccine schedule. In fact, 2 years ago, out of 700,000 doses that were given to children, I think that 2 or 3 cases of myocarditis were seen. And myocarditis is a complication of COVID-19. So when you actually look at the risk of myocarditis due to COVID versus the vaccine, it's much, much higher related to COVID. But again, with the way the vaccine schedule is given now, myocarditis is not seen. Now, as far as
just if I could, yeah. I mean, so I remember that some Scandinavian countries like Denmark and Sweden officially recommended against vaccinating healthy children for COVID. Moderna COVID vaccine was banned or restricted in parts of Europe for people under the age of 30. Have those policies changed?
I'm not familiar with those international policies at all, but I do want to go back to the statement you made that individuals, a young child, can have 70 doses of vaccine over the course of their lifetime with a risk of myocarditis. That's not correct. And then also, in terms of routine vaccines during certain seasons, individuals will get a flu vaccine every year as well. So, flu, again, is a serious illness. Up to 20,000 people will die a year from flu, including young and old. This past year, we had 50,000 people die from COVID-19. Most are older individuals, but it can affect younger individuals. The risk is greater for people who are older. So this is why, in terms of looking at what's the greatest risk, for children, it really is the very young children, which is why the American Academy of Pediatrics has recommended that COVID vaccines be given between 6 months and 2 years of age, because that really is the highest risk factor now, even for healthy children, getting hospitalized, and make it optional between children 2 and 18 years of age if parents want it.
The American Academy of Pediatrics, the AMA, these are sort of these advocacy organizations that are always referenced as biblical in terms of their standing. They've said, and so that's the end of the discussion. But I wonder if you think those same organizations and public health officials, both in the government as well as at the academic level, that were particularly prominent during COVID, if any sort of acknowledgement of things they got wrong widely distributed would assist in these sorts of discussions? Or do you think that for the most part, they did everything right based on what they knew at the time?
Yeah, I mean, there's some things that I haven't always agreed with in terms of some of the recommendations that came out during early part of the pandemic. But, this was a new virus, very serious virus. We lost a million people in this country during this pandemic, and some of the things that were new about the virus compared to flu was that the asymptomatic spread was a big part of this. In terms of some of the areas, I think related to some of the school policies, first in terms of schools closing and then schools reopening in the summer of 2020. Again, the first case of COVID in the United States was in January 2020. Most of the schools in the United States closed in mid-March of 2020. And then we had this bifurcated response where some schools opened in the summer of 2020 and some schools remained closed. And the American Academy of Pediatrics had recommended tying school reopening to what the prevalence was in the community. And I disagreed with that. And in Florida, we reopened our schools at a time when we had very high levels of COVID in the community. And we did so successfully. But I do also need to point out, in terms of the impact, on children, when we went into July of 2021, when we ended up having the Delta wave for COVID coming in, COVID really had a pretty significant impact on children in Florida. And, I monitored this very, very closely, and I've actually written about this. We had about 20 children, most of whom were all healthy, who died over this 3-month period when we had the Delta wave from COVID, and these children were not vaccinated. So, COVID did take its toll on children over this period of time. And this is why, in terms of protective measures within schools, surveillance, making sure that vaccines were available to children was one of the important things that we did.
Just the VAERS system, the vaccine adverse event reporting system.
Sure.
Is there a way that could be improved, or that could be more widely addressed by public health professionals to perhaps inspire more confidence about some of these vaccines, including COVID?
Yeah, so first of all, it's a reporting system where individuals will submit information about side effects they have. This is one of the things that we actually advocated, and we actually gave up when, the early days of the pandemic, when people get vaccinated, we'd actually give them cards, if they have side effects, to report this. So whether it's COVID vaccines, whether it's flu vaccines, whether it's a medication, if people are having side effects from these, it's important that they report them through the system, which goes to the FDA, so they can be looked at and monitored. And again, public involvement, physician involvement. This is one of the things that when I'd have calls with medical groups saying that, if you're seeing patients that have side effects, make sure that these get reported to VAERS. And so this way we can track, what is happening. So in terms of that portal, I've used it myself. I've submitted information that way. I think the issue comes down to making sure that people are aware of it, and that this does get reported. And then also the FDA continuously monitors this and looks at these different side effects, and will pull together the information about it and look for trends that may be disturbing.
When you see stories coming out of places like California that because there was a spike in COVID cases that officials are recommending kids wear masks at school. What's your reaction?
Yeah, in terms of masks, it all depends on the circumstances where you are. So first of all, it depends on the type of mask that's being worn and where it's being worn. So, for example, we know that COVID really does not transmit well in the outdoor environment, and so because of this, having doors open, windows open, effective ventilation is really, really critically important. And in terms of the mask which is being worn, an N95 mask is really the one which is effective. Cloth masks, surgical masks that are worn over the chin, which we see a lot, are not going to be effective. So from my point of view, ventilation is one of the most critical factors if you really want to decrease spread. There is evidence that there can be a modest effect of masks, but on the big scheme of things, less effective than some of the other measures.
I mean, after all the mutations, is COVID any more dangerous in terms of serious illness or death than the seasonal flu?
Yes.
It is more dangerous still.
Yeah. So last year, Dan, if you look at the data, last year, 50,000 deaths due to COVID, and half those number of deaths due to flu. So it remains a serious virus.
And what percentage of those were 65 plus? Do you know?
Most individuals are older. So during the pandemic, we had more than 1 million deaths. More than 85% of those individuals are 65 years of age and older. But we do have children who will die. We have young adults who will die as well. So, it preys on, it heats a fury on older people and the medically vulnerable, but it also affects other individuals, which is the same for flu. And this is the reason, flu shots have been around for decades, and this is why the recommendation is that, individuals, young and old, end up getting flu shots, and for COVID vaccines as well, if people want to get one, they should be able to get one.
What about 6 feet apart? Should we bring that back too?
Say that again, sir.
What about 6 feet apart? Should we bring that back as well? 6 feet apart, standing 6 feet apart. The circles on the floor and all that. Remember that?
No. That's First of all, we're in a different situation now than we had before. So first of all, you have lots of population immunity due to vaccines and individuals having had COVID. So we're in a different kind of situation than we were early on.
Dr. Scott Rivkees is a professor of practice at the Brown School of Public Health, pediatrician, and former state surgeon general and secretary of health in the state of Florida as well. Dr. Rivkees, thanks so much for your time. Appreciate it.
It's been an honor to speak with you. Thank you so much.
Thank you. And you joined us on the Turnkey.Pro answer line.
This is Chicago's Morning Answer.
Your show keeps me alive during the week. There's nobody I'd rather listen to between 5 and 9 in the morning than you guys.
On AM 560, The Answer.
When the power goes out, life stops. Heat, AC, fridge, phones, all gone. But with a Generac home